This is an important day for Urban Family Practice, their 25th year celebration. They've been a part of this community for 25 years. Tony and Dr. Vasquez has always been looking out for their community.
Oh, it's just a wonderful festival we're having today. We're having a health fair.
Oh, well, today is a great day with great weather. We're very excited to team up and put together Urban Family Practices Health Fair.
We want to make sure everybody has access to medical care in this community. So we've been here for 25 years, doing health fairs every year on Niagara Street for the community.
We try to include everyone in the family.
Have some health screenings going on. We have things for kids to do. We have face painting. There's a chalk section.
We have the DJs, a band that's going to come in and play some Latino music, something that would surely resonate being in this area.
We have a bunch of CBOs from different community organizations in the city of Buffalo.
We have some fruits and vegetable giveaways, some clothing giveaways.
There's food and there's music.
Kids are excited. We're giving away prizes. They have the snow cones. We have candy canes.
We're here really to service the community and help the community. That's why we are doing vaccines as well.
Dr. V's here all day, up and down, talking to patients, talking to members, future patients, future members of Urban Family Practice.
I think this event is very special, it's very community involved, it's open to all the community and provides services to them as well. That's very beneficial.
At the same time, we are also celebrating their 25th year anniversary
of Urban Family Practice being open for the community, especially for the minorities.
It's super important because this is and probably one of the only longest in business establishment, probably in the city of Buffalo, that's minority. So it's a huge, huge, huge thing to do to celebrate 25 years. Some people may not think 25 years is a lot, but if you think of it in terms of a marriage or you think of it in terms of being on your job, 25 years it's success.
25 years is a big milestone. That shows that they've been in this community for 25 years and providing care and social needs to everyone that's in this community and outside of just downtown Buffalo. It's very important to Dr. V and his wife. They started in a little house down the street, and now look what we've become, and we're servicing more people. It just shows to the longevity in this community and their dedication for 25 years to be around.
They were resilient and they stayed to the course, and I think that's worth talking about and that's worth sharing on this special day.
There's a whole parade going on too, so it's really fun.
We just finished walking our Puerto Rican parade, which started in downtown and ended right here, right next to our urban health fair.
We were enjoying the parade, seeing everyone from all different walks of life. People are happy to see G-Bond and Urban Family Practice together, for the community.
A lot of floats, a lot of nice cars. We also had United Healthcare, which was they're part of our Puerto Rican parade every year.
Just embracing the culture and just seeing people lined up.
Dr. V was in the parade with us. He was there for the flag raising ceremony, and then he was with us the whole time.
Dr. V, he was excited, and we were walking alongside of him, and the music is going, smiling. His mom was walking in the parade, and we were giving out T-shirts,
which we gave to a lot of people. We had 4 vans. We had about 5 boxes in each van, and they were all gone by the time we made it to Hudson.
So now we're on Niagara Street at the Urban Family Practice Health Fair, where right now we're doing high blood pressures, the mobile unit that's giving out vaccinations.
We are doing retinal screenings for diabetics. We have COVID vaccines on site here.
We have flu vaccines being given. So we're doing a lot of screenings.
We have seen numerous people coming in and from the parade coming into the health fair.
What we would like for people to do is once they enter into the health fair, they're supposed to go to our registration tables.
That's what I would come in and guide that person to our 2 registration tents available at the one on Jersey location and the one on Pennsylvania.
From there, they receive a passport. And with that passport, they're supposed to be getting at least 4 Urban Family Practice health screenings.
Blood pressure, asthma,
blood glucose monitoring.
We're doing finger sticks.
And all the good stuff that we offer in the clinic.
And they have to at least visit 3 of our community-based organization tables.
And I would guide the people to the different tents and different stations where their passport can be punched.
Once they've completed that, they can come to our table, which is the ticket table, and from there they will receive a food ticket for a food voucher, and with that food voucher you can
be able to go to the Floor Bakery, Niagara Cafe, or the Nickel City Mini Mark.
And we also give them a t-shirt that says Urban Family Practice 25 years of service, along with the Urban Family Practice sunglasses.
It's a raffle when you don't all the tables.
We're about to give out some tablets in addition to the grand prize and a couple more bicycles.
We have bikes for kids.
I found out that they were actually giving away a trip for 2 to Puerto Rico.
And when times come, they will call your name and from off the stage if you win.
We saw the different kinds of kids winning for bicycles. They were so happy. We are seeing kids right now having fun in the different kinds of tents that we have.
We have bounce houses set up, we have popcorn, we have cotton candy, we have snow cones. Snow cones are going to be great for a day like today.
We are working in the health fair in the kids zone area. The kids are enjoying it.
I came with my daughters early. We went to the bouncers' houses. They went to the tables. They were near to the bouncing houses. They got popcorn. They got cotton candy. Then they were playing around. They kept going one bouncing house to the other bouncing house. It was like crazy.
Our role is to monitor the kids, to make sure they're having fun but being safe at the same time, and that the parents are nearby, you know, in case anything happens.
We also saw different kinds of cartoon characters, including Paw Patrol, including Ninja Turtles.
My role was Minnie Mouse, and I really enjoyed that role. I got to interact with the children. They loved it. I had a lot of kids just running up and hugging me. I felt like Beyonce because everybody was like, "Can I take your picture?"
We have our urban tent where they will be testing, doing all sorts of things as far as health is concerned.
Screenings, information, things that people in need should have.
All right, inside our medical clinic, we're doing finger sticks, checking A1Cs, we're doing blood pressure, eye exams for diabetic eye exams. We're also doing peak flows for asthma.
So the first one is blood pressure. I take your blood pressure and then I click the ticket. It's good to know because sometimes Patients don't know they are suffering from high blood pressure, so it's good to know.
I'm here today under the Urban Family Practice stand doing asthma test control for anybody who want to get tested for asthma. I hand them the peak flow meter, they take a deep breath, they blow through it, and if they blow 300 and above, that's a good number. If they not, they just try to do it one more time. If they blow below 100, then they do have asthma.
They were doing COVID tests in the V-van.
It's very important to get screened so we can, if there's something going on, we can address it at its early stages. What we see is a lot of people in our community that don't go to the doctor, they don't have a doctor, so they never get screened for years and years, and it's something that could be going on that we can address ahead of time so it doesn't get to a point where we can no longer do anything for them. So it's very important for people to get screened and take health care serious. On top of COVID, there's other medical conditions that people have that they're not aware of, and then it's too late by the time they find out. So it's just good to get screening ahead of time.
So today we have our Zumba instructor Jesse and his wife, and together with the wellness department we provided Zumba, so got everybody to dance and get their fitness on to improve their health.
I am fanatic of Zumba personally. I can stay still, so it's good for me. When the people from Zumba get in the middle of the stage and the music was playing, I jump in, and when I see to the side, I got my little ones, my daughters. They were dancing. They have a blast. They danced the whole time till the last song.
We did see a lot of different people, whether it was staff members or our members that we currently have, our patients, or even just other people in the community that I have never met yet. So it was great to see new faces and even children coming along and dancing right next to me. So because I'm a yoga instructor as well, I thought it would be a great idea to get everybody to stretch and improve their strength and mobility through yoga. So I had a few people show up and I led them through on a nice patch of land, and there was some Puerto Rican and Hispanic music coming along, and everybody absolutely loved it as we were breathing and stretching and focusing on our mental health while exercising. So it was really fun.
We're making it an educational event where you can learn about health conditions.
Well, today I'm manning the information center, and basically we're giving out information about diabetes, asthma, colon cancer, all types of information that people need to keep them healthy. My whole area was free. We were giving away free clothing, we were giving away free information, and we're also giving away free fruit bags.
People really like to get their fruits and vegetables, as well as milk.
So our whole tent was actually free. So when people came up, they were really happy.
We kind of looked at everything that's going around and all of the social determinants of health, and that's how we were able to do the community-based organizations that are here with us today.
A lot of people are excited to team up hand in hand.
We have all sorts of CBOs.
We have a lot of great organizations here that offer services to the community.
Like insurance, barbers right here where kids can get free haircuts.
We have, with us today, we have our premier sponsor, which is United Healthcare. We have our stage sponsor, which is CAI. We have the Girl Scouts that will be making masks with our children. We have bounce houses. We have lots of activities for the little ones, face painting. We also have Univera, Circuit Clinical, which is giving information out about trials, and we know that trials are super duper important in minority communities because it allows researchers to gather data so they can better serve the community. But oftentimes these trials were never in the Black or brown communities, so therefore they were not a part of any of the solution. The data didn't represent them. But now things are changing, and you know, to Dr. Vita does a lot of collaboration. You know, that's what comes out of it. You know, it's got to be a whole village to work with the community, and I think today those that are with us here are doing just that. Durham's maternity is super important. They deal with pregnant women. They have a lot of education around pregnant women. They also can get pregnant women with a doula, so they can avoid some of the nightmares of having a baby. And we have REACH and CAI, and they're talking about the prevention of cigarettes. Not only not smoking, but also the advertisement. If you look at the advertisement in the inner city, in the urban city, the advertisement is much different than it is in the majority communities. So we not only have to show our people don't smoke, but don't allow that publicity, that marketing to come in and trying to sell items to our people and to our kids that really is against good health.
The connection, that you get interaction with all the people is great.
So one thing that I really enjoyed today, it was talking to Hispanic community. So one thing I talk about today to the community here is about GBON services, like transportation and wellness program that we help with care coordination. One good thing about GBON services is that we have diverse staff that speak different languages that can help you finding doctors, dentists, and things like that. That is difficult because there's a lot of people who is Hispanic here that don't speak English at all. Care coordination, they help them with scheduling the appointments.
When you look at the social determinants of health and some of the things that are barriers to healthcare in minority communities, one of them is language, and we tend to address that, you know, very well.
We're happy to assist you any way we can. You can enroll into a GBON where we can assist you with your appointments, transportation, and all kinds of things.
One of it is food. They live in food deserts, and so today we're giving out food bags, so you know, that's super duper. Some of it is clothing. We have clothing today. Some of it is housing. We even have housing for those that were impacted by COVID-19.
And we incorporated so many various ethnicities and provided them with wellness and things that they don't have to really improve their health and reduce their chronic conditions.
We have a new pediatrician that's part of our family now. We've expanded from this location to Jefferson and East Utica. We are now on Main Street, so we cover and cut a big swath out of Buffalo as far as where we are located and the people where we are helping. So welcome to this day. It's going to be a beautiful day.
So Mayor Brown announced today, August 28, 2021, that this day will be for urban family practice.
That wasn't a special moment.
That was powerful. That came from our mayor, Byron Brown, and he created this day that it would be a monument in history. It would go down as Urban Family Practice Day. And that just shows you, once again, how others outside of urban family practice value the work that they do.
It was a great experience, a great opportunity for Dr. Vasquez and Tony Vasquez for all they have done for Buffalo.
They were out in the trenches when COVID came up in 2020. And they're still in the trenches. They're still doing pop-ups. They're still going to communities We talk about food deserts, but there's also medical care deserts.
The importance of healthcare in the community.
I think that speaks volumes as far as the work that they've been doing in the community, how far they've come along and still here and going, and with a very bright future.
And it was a great honor while he read the whole proclamation.
It was a proclamation for the work that Dr. V and Tony are doing in the community, and just thanking them for the 25 years of service that they've given to underprivileged communities, and
for all the dedication, giving back to the community, keep growing and make things for the people, for Latinos and Americans together in a place is great, and they were so excited in that moment.
This is something that we all need to aspire to do, is to do exactly what they're doing, and it's just a beautiful thing that they're putting all this energy and effort into the community, and the people that are employed with them, they take us right along. So it's just a wonderful thing.
I mean, how can you celebrate 25 years? How can you celebrate a man without celebrating his mom, the matriarch of the family? And so it was an honor to give her flowers on this day and to remember her as she looks at her son with such, proud, and then he looks back with his mom, who has been with us through many of our groundbreaking and ribbon cutting. She's been there, and I'm sure she was there throughout his entire life, giving him the extra push, support, and stability that he needed in order to get where he is today. And not to mention Camille Gator, which is Tony's mom. We will be putting up planting a tree in her memory, who was a resilient African-American woman. So to honor the mothers was priceless, very fitting for the day.
Also today, Dr. V and Tony were given another recognition by Senator Kennedy and Charlie Torres.
Proclamation honoring him for allowing the Puerto Rican Festival and the Urban Family Practice to become one united event. It was a little different than what we're accustomed to, but we had over 2,000 people that walked by 564 and 555 Niagara.
His wife, Betty Cabo, was also here.
Judge Torres, she also spoke and gave her remarks. They're longtime friends of Dr. V, longtime supporters, and it was good to see people come out and share in the celebration.
It was a moment when the band started playing live. He grabbed his mom, and his mom was so happy. They were being dancing and stuff. Like, that's what reminds me Puerto Rico. Puerto Rico, you see that, you see family getting together, enjoying the music, enjoying the time, It's very, very grateful that day. And seeing Dr. V enjoying with his family, they were dancing too. Dr. V and his wife, Tony, they were having a blast. It was joyful. It was feeling like home, like being at home and spending the time, seeing Dr. V speaking Spanish and English, and seeing everybody connecting to each other. It was so fun.
It's just been a wonderful, wonderful day.
We're having fun. I'm very happy that we have a lot of people here today.
I think they enjoy it. I really think so.
Everybody was having fun and we're enjoying themselves.
And I have a great time talking to people as well, especially the Spanish speaking. They get very excited when they can find somebody that speaks their same language.
It's just to see people engaged and people actually doing screenings and people who want to get involved. It's just nice in conjunction with the cultural celebration.
I had a blast. This was my first year doing the health fair. They didn't have one last year because of the pandemic. So this year it was a lot of fun. I had a lot of fun here.
During this whole fair, I had a great time just to see people getting different types of tests done, the prizes, the giveaways, and not only that, but give a focus back to the community in which that we're all about helping the community and helping when they need them the most, especially in healthcare.
The kids were wonderful.
Every year I've been out here and I love it. It gets bigger and better every year.
In Puerto Rico, when they do like festival like this, you see everybody coming and everybody go everywhere to see what people got, what other people has, and to see, and they laughing at each other. Every little thing that happen, it's like it's a great time. Like it's good memory. Like seeing a lot of Latino mixed with a lot of people from here.
I really enjoyed the health fair. I love bringing in my personality and my passion, which is dancing, exercising, talking about health, how to change your lifestyle through small steps, and just making everybody smile.
It's wonderful to be here enjoying this moment. I felt great. I think that our committee, you know, they bought into the idea. I think by opening it up and allowing the different teams to be around the table, they were able to see not just giving an event, but being a part of it. It was extremely hot today. It's a lot of sun out here, but there's a lot of smiles out here, and there's a lot of people that are proud to be of Latino background. They're proud to celebrate the Puerto Rican Festival and proud to be a part of the health fair. So I would say good day. It's a good day.
I love these types of things because I know I'm giving back to the community, and I just thank God for Dr. Vasquez and Tony for having this vision to help the community and give to the community.
I know that Dr. V and Tony are very big about helping out the community, especially the underserved communities.
I think that Dr. Vasquez and Jivan and Urban do a really great job trying to get everybody, all languages, integrated into the community.
It's all about the community, giving back, getting healthy, and keeping everyone around a little bit longer than they normally would be.